I'm a family physician in inner city Saskatoon, on the west side of Saskatoon. I've also had the chance to work in northern Saskatchewan, all over rural Saskatchewan, and spent a fair amount of time in Mozambique in sub-Saharan Africa as well. And this is work that I enjoy a great deal. I love being a physician. I love having someone come sit down in front of me, share a problem that they're facing, and be able to help to some degree, whether it's with advice or medications or directing them on to someone smarter than me. That's a great thing to be able to do. But it's also very frustrating because it's very clear to me that much of what I do really doesn't have the impact that it should. About 25% of whether you're going to be ill or well, or whether you'll live shorter or longer lives, that's result of the healthcare system. And that number comes from a lot of guesswork, but I think the point is clear, that it's in the minority. I see there are some medical students in the room today. I'm hearkened back to my days in medicine where we were first introduced to this concept of the social determinants of health. And we were all asked, what makes the biggest difference in whether somebody be healthy or not? And people put up their hands: healthcare, genetics, culture. And a lot of the students were really shocked to learn that it was income, education, employment, housing, nutrition, the wider environment. Those are the things that make the bigger difference. I think today's medical students are a little brighter than we were. So this is a concept that's gaining more and more understanding. We need to be thinking about health in a way that moves beyond the healthcare system and really look at what is it we're trying to achieve with our system as a whole, with our government as a whole. And I like to think that health is exactly that. If you look at the World Health Organization's definition, it's not just the absence of infirmity, it's full physical, social, and mental well-being. Which seems to me like a pretty fantastic motto for what you'd be trying to achieve as a country. Full social, physical, and mental well-being for all really could drive a whole of government approach to considering health outcomes when we make our decisions. And looking back to that list of the determinants of health, income, education, employment, etc., you can see how, one, that's the evidence is there. We know that's what will make a difference in reaching that goal of health. But it also provides us with a course of action. That is the stuff that politics deals with. That is you can map each of those determinants onto ministries. That can give us a guide to how to think with a health in all policies framework, how to think with a whole of government mentality about integrating considerations of health outcomes into all our political decisions. We measure this all the time. We measure health outcomes on life expectancy, infant mortality, specific illnesses. In fact, epidemiology is a science that's advancing so far. We can now, using sophisticated modeling, figure out what the implications of a widespread policy will be on very small groups or even individuals. We still make our decisions based on ideology, based on what seems to be popular in the polls, what will get us reelected. Facts may play a role, but it's not a starring one. And I really think that this concept of putting health outcomes at the core of what we're trying to achieve in our government, in our public system, gives us an opportunity to move into evidence-based policymaking, evidence-based decisions. One of those pieces of evidence that I like to talk about comes from a book called The Spirit Level. It's Richard Wilkinson out of the UK, and what he did was he showed how countries with different levels of inequality have very different health outcomes. So the more inequality, the worse the health outcomes. All up the social gradient. If you're a wealthy person in a less equal country, your health is going to be worse than if you're at the exact same level of wealth and social status in a more equal country. There's something about greater levels of inequality, whether it's more crime, greater burden on social services, or just that tension of being so far apart from the rest of your community, that makes us sicker. Really, this is a way to appeal to both those altruistic feelings that exist to different degrees in every one of us, but also that self-interest that exists to different degrees in every one of us, because it's an argument that shows that the right thing to do is also the smart thing to do. It's something that will improve all of our lives. And to me, this is just an example of a way in which that concept of health outcomes really allows us to appeal to a value, a desire that reaches across the political spectrum, that isn't just sectoral, that really invites everyone, because we all care about the health of ourselves and our neighbors and our families. We're trying to move people towards understanding the evidence around the determinants of health, sharing the stories that really illustrate how that evidence plays out, how those determinants of health play out in the lives of individuals, and really building a movement, building a community that is demanding that our governments, our leaders, and we ourselves respond to what is it that we're doing to achieve full physical and social and mental well-being.